Hello, it's Lauren Ohayon from Restore Your Core, and today I want to talk to you a little bit about your pelvic floor or the pelvic floor and hormones, specifically what happens around perimenopause and menopause. Now, I want to start off by saying I am not a medical doctor. This is not medical advice. This is simply factual medical information that I strongly believe every single pelvic floor professional, movement professional working with females should know and understand, so that when your clients come to you, you feel like you have an answer or that you at least know what they are talking about. So I'm not giving any advice here, just putting that out there, just giving factual information. In our 40s, the very important changes that lead into menopause begin to happen. For some people, that happens in their late 20s. That's pretty uncommon, but it happens. And for a bunch of people, actually, it does happen in their 30s. And then very commonly by the 40s, this is what's going on. And I think that people think that menopause happens overnight, and it doesn't. Yes, there is one moment where you have your final period, for sure. And then after that, you don't get one again, and now you are officially in menopause. But leading up to that moment, there is a lot of fluctuation happening in your female hormones, the hormones of estrogen and progesterone. And the hormones are going up and down and up and down and up and down. And then, so it's like these massive drops, sometimes less, sometimes big. As you get closer and closer to menopause, you're starting to, have way more moments without these hormones, or with less hormones than with more. I want to just explain and so when you go into menopause, by the time you're in menopause, you are in a drastically decreased state of these hormones, which has a very specific effect on the pelvic floor. Now, it has an effect on the rest of the body, but again, that's not what we're talking about, because I want to explain to you what happens to the pelvic floor, how it might show up in your clients, and what are some things you can possibly think about and know about. The decline in estrogen, let's talk about what estrogen does to support the vagina, the vulva, and the pelvic floor. It creates elasticity. It helps with collagen production. Estrogen and elasticity go hand in hand. Estrogen helps create moisture of the vagina, right? So a declining in estrogen leads to declining of vaginal moisture. It also helps maintain, let's just call it maintain, a really good balance, a really good pH balance of the vagina. And it is really kind of, again, creates like thicker linings of the vagina and the vulva. So the term for what happens to people in peri, but very specifically in post-menopause in their pelvic floor, is called GSM, which is the short version of genitourinary symptoms of menopause, or genitourinary syndrome of menopause. So it's like, it's been given this name. It used to be called the senile vagina, which is not a very nice name. And it also used to be called vaginal atrophy, which doesn't really explain what's happening. So the symptoms range. They can be urinary symptoms. You can be a lot more frequent urination. People suddenly start getting tons of UTIs. There can be pain with urination. There can be incontinence. You can have sexual symptoms, pain with sex, less orgasm, vaginal dryness. You can have vaginal atrophy, where the clitoris starts to adhere to the hood of the clitoris, called phimosis. You can have your labia minora start to disappear. So literally the tissues start to atrophy, because estrogen, like I said before, is responsible for keeping things kind of thicker, fuller, wetter, and more lubricated and more elastic. So when we start to take away the very thing that causes that, we are now getting a decrease of all those things. So you can have vaginal atrophy. The lips, the labia can start to disappear. You can have a lot of pain around the insertion, if you are having penis in vagina sex, you can have a lot of pain right at that entry point. You can have a lot of dryness in your vulva and vagina, which leads to a lot of pain, burning, razor sensation. And you can suddenly have a prolapse, right? People start experiencing hypertonic pelvic floor, prolapse, like I said, incontinence. So there's a lot more symptoms. If you look up GSM symptoms, you'll see there are many more symptoms. Again, not being a doctor, there's like out of my scope to really go into like the whole thing, but I just want to kind of put that out there. That these are things that happen, and a lot of women are super ill prepared for it. They had no idea. The sex drive goes down, their libido goes down, sex is suddenly painful, everything is dry, and again, there are wonderful treatment options, and then there are wonderful choices to let nature take its course, right? So different people do different things. That's not what I'm here for, to talk to you about. It's very important, though, that as you are working with women in their mid-40s and older, and they're coming to you with prolapse and incontinence and complaining about vaginal or vulvar changes, it's important for you to know that this could be because of menopause. And I think that when we don't acknowledge that, we make women feel more broken, and like something's wrong with them, and nothing's wrong with them. They're having this normal, natural life change. So I never tell my clients that I think they should go on HRT or topical, local. You can get creams that are not systemic, that are estrogen creams just for the vagina and the vulva, which dramatically reduce a lot of this stuff. You can do that. Now, it's not my job to tell my clients what to do, but I know what the treatment options are, and I always tell my clients, I'm not going to tell you what to do. You can do, right? You can do you, but know your options. Know that this might be because of perimenopause or menopause. It's good for your clients to know that this could be happening because of a life stage, not because they, did something wrong, or they have a bad body, or their body is somehow not right. So I think that us as pelvic floor professionals, we do owe it to our clients to explain to them, like, are you aware of are you aware of GSM? Like 9 out of 10 of my clients are like, no. Now these days more and more, because people see me talking about it on social media. But generally speaking, a lot of my clients start with no. I think it's unfortunate that movement professionals are not telling their clients who are coming to them with these issues, are not saying, do you know what GSM is? It could just be that. Do you know what GSM is? No. I'm just going to recommend you go read about GSM. That's what I do all the time. Go read about GSM. A lot of the symptoms you're talking about are related to GSM. It's just good to be armed and empowered and in a space of knowledge. Now, movement can really help. So it's not like I say to people, oh, go get a hormone and you're going to be okay. Absolutely not. My clients who are, moving and taking care of the function of their pelvic floor and going through menopause at the same time are doing amazing. Not all of them, right? Some of them need extra support, but the power of movement is huge, but it doesn't replace estrogen. I wish it did, but it can actually make you feel great, and endorphins, and it supports hormonal production and supports hormones. So, the answer is not, well, there's a hormone for that, that's all you need. No, the hormones do great when actually a pelvic floor is functioning, right? So we really want to optimize the pelvic floor in conjunction with any treatment they choose to do or not do. Again, I'm not here, I don't really care what treatment choice they make. I always encourage my clients, they're with me, so they're moving, they're doing that, and then just be armed with the information. So as a pelvic professional or a movement professional, that is my advice to you. Learn about GSM, know that it can create incontinence, and prolapse. Know that somebody having a dramatic change in their pelvic floor and they're like 48 years old or 55 years old, in your mind, you should also be thinking GSM. And if you've tried all sorts of things to help their pelvic floor regain function, but it's not working, it might be because there's this thing called estrogen that no amount of movement can replace. Movement can support, but can't replace. And I think it's important just to remember that. And that's it. I hope you've learned, and off we go.